Spotlight on America correspondent Angie Moreski. With the health care affordability debate raging, a new push is underway to pull back the curtain on medical pricing. As we've reported, new federal rules that took effect 5 years ago to increase transparency haven't done the job. But now lawmakers say the Patients Deserve Price Tags Act could change that. And as we discovered, it's one of the few things in Washington these days actually getting bipartisan support. In Washington, you don't hear these words very often.
Republicans like it, Democrats like it. There's a unified effort.
Democratic Senator John Hickenlooper of Colorado is teaming up with Republican Senator Roger Marshall of Kansas for the Patients Deserve Price Tags Act.
Both sides agree that transparency, price tags, is going to bring the cost of health care down. If you're against transparency, then I don't know how you could get elected.
Hospital price transparency rules that took effect in 2021 mandated hospitals publish detailed price information in consumer-friendly formats. But a 2024 audit by the Department of Health and Human Services Inspector General found nearly half of the nation's almost 6,000 hospitals were not meeting federal price transparency rules. What's driving the lack of transparency?
Insurance companies and hospitals don't want you to know. They don't want you to see the guy behind the curtain. They want it to be so complex that they can do their voodoo and not want the American consumer to see exactly where the dollars are going.
As an OBGYN and former hospital administrator in Kansas, Marshall has seen the process from the inside.
Healthcare is the only business model out there where patients don't get to know the prices.
This bill would strengthen and expand federal rules already in place, making it law for hospitals, insurers, and providers to release clear cost information up front, including personalized statements, negotiated rates, and cash prices.
Take the proven benefits of competition that we see out in other marketplaces and saying, listen, let's put that competition in this marketplace.
This is not Congress's first crack at creating more hospital transparency. The No Surprises Act, passed more than 5 years ago, was supposed to stop patients from being blindsided by big bills, requiring hospitals to provide good faith estimates and make billing less confusing.
There has been nothing transparent.
But patients like Carrie Schrader told Spotlight her medical bills after getting a muscle biopsy in 2024 were frustrating and more confusing than ever.
I have a master's degree. I guess a master's degree doesn't work. I need a PhD in biology.
Why hasn't that worked?
So no teeth. It didn't have enough teeth. This is the first time where there's really going to be consequences if they are not complying.
The bill would drastically increase fines up to $10 million a year for non-compliant facilities and provide other strong tools for enforcement.
Our bill closes a lot of those loopholes and says that, look, if you want to participate in Medicare or Medicaid, then you have to do this.
Once that competition works, the savings will be so dramatic.
Senator Hickenlooper says another key provision would give business owners more transparency, allowing them to have increased access to employee insurance data.
Total transparency is going to allow the large employers to really manage their healthcare costs, which will drive them down. As they drive them down overall, I think it's going to go down for consumers as well.
Everybody watching agrees that the cost of healthcare is too high.
A similar bill last Congress never made it out of committee, but recent Senate hearings are fueling growing optimism this could break through.
You can feel the momentum up here when something is catching fire.
What do you think is making it such a bipartisan connector?
The cost of healthcare now is so high that I think the American people are shouting to Washington, fix this, help us.
The Patients Deserve Price Tags Act has already made it farther than it did in the last Congress. We'll be watching closely to see if it actually gets a vote this time and keep you posted on what happens. For Spotlight on America, I'm Angie Moreski.